Hi, welcome to my YouTube channel. Today we will discuss about enema. Definition, purposes, contraindications, amount of fluid for large volume enemas, size of rectal tube, classification of enema, general instructions while giving enema, and some important points. First we can see the definition. An injection of liquid through anus to stimulate evacuation, sometimes used for diagnostic purposes. Next we can see the purposes. To stimulate defecation, to soften hard fecal matter, to destroy intestinal parasites, to relieve gaseous distension, to administer fluids and nutrients, to relieve inflammation, to induce peristalsis, to decrease the bowel prior to surgery, diagnostic procedure and before delivery of a baby, to introduce medication. These all are the purposes. Next is contraindications. Acute renal failure, appendicitis, obstetrical contraindications, cardiac problem, recent colon or rectal surgery, intestinal obstruction. Next is amount of fluid for large volume enema. For infant 50 to 150 ml, toddler 250 to 350 ml, child 300 to 500 ml, adolescent 500 to 750 ml, and for adult 750 to 1000 ml. Next is size of rectal tube. For infant 12 French, child 12 to 14 French, adult 22 to 30 French. Next, classification of enema. Two types are there, evacuant enema and retained enema. In evacuant enema, first one is simple evacuant enema, second one is medicated evacuant enema. In medicated evacuant enema, first one is oil enema, second purgative, then astringent, antihelminthic, carminative and cold enema. Retained enema includes stimulant enema, nutrient enema, emollient enema, sedative enema and anesthetic enema. First we can see evacuant enema. In that, first one is simple evacuant enema. Purposes include to treat constipation, to stimulate defecation, to relieve gaseous distension by stimulating peristalsis, to stimulate uterine contraction and to hasten childbirth, to cleanse the bowel prior to diagnostic procedures. The solutions used: soap 50 ml and water 1 liter, normal saline, that means sodium chloride 1 teaspoon to half liter of water, then tap water. Amount of solutions used: in infants 250 ml or less, child 250 to 500 ml, adults 500 ml to 1000 ml. Next is temperature of the solution. In children 100 degree Fahrenheit, in adults 105 to 110 degree Fahrenheit. Next is medicated evacuant enema. In that, first one is oil enema. It's given to relieve constipation before the first bowel movement after operations on rectum and perineum. To avoid straining and injuries to the sutures and wounds, return it for half to 1 hour to soften the feces. It is then followed by soap and water enema to clear the bowels. The solutions used: olive oil, castor oil, gingerly oil. Amount of solution 115 to 175 ml and the temperature 100 degree Fahrenheit. Next is purgative enema. It's given to cause the bowel to contract actively and to evacuate its contents. It acts by its irritating effect on the mucous lining, stimulating peristalsis and cause evacuation of the bowel. The solutions used: pure glycerin 15 to 30 ml, glycerin and water 1:2 ratio, glycerin and castor oil 1:1 ratio, magnesium sulfate 60 to 120 ml with sufficient amount of water. And the amount of solution 115 to 175 ml. Temperature of solution 100 degree Fahrenheit. Next is astringent enema. It contracts the tissues and blood vessels, checks bleeding and inflammation, lessens the amount of mucus discharge and gives a temporary relief in the inflamed area. It's used in colitis and dysentery. The solutions used are tannic acid 2 gram to 600 ml of water, silver nitrate 2% dissolved in distilled water, and alum 30 gram to 600 ml of water. The temperature of the solution given as hot as patient can withstand. Next is antihelminthic enema. It is to destroy the worms and expel it from the intestine. The solutions used hypertonic saline, sodium chloride 60 ml with 600 ml of water. The amount of solution is 250 ml. Next is carbonative enema or antispasmodic enema. It is to relieve gaseous distension of abdomen and to expel flatus and feces. The solution used turpentine 8 to 16 ml mixed with the 600 to 1200 ml of soap solution. Next is cold enema or ice enema. It is to decrease the temperature in hyperpyrexia. Temperature of the solution is 80 to 90 degree Fahrenheit and the complications include hypothermia and abdominal cramps. The second type of enema is retained enema. In this, the enema is retained in the bowel to allow the contents of enema to be absorbed through the bowel wall. The first one is stimulant enema. It is to treat shock and collapse and in opium poisoning cases. The solution used black coffee, 1 tablespoon coffee powder to 300 ml of water. Amount of solution is 180 to 240 ml. The temperature of the solution is 108 to 110 degree Fahrenheit. Next is nutrient enema. This is to give fluids and nutrients to body. The solution used normal saline and glucose saline. The amount of solution is 1100 to 1700 ml in 24 hours or 180 to 270 ml 4 hourly. The temperature of the solution is 100 degree Fahrenheit. Next is emollient enema. Introduction of bland solution into the rectum for soothing and relieving irritation on an inflamed mucous membrane. Solution used starch and opium, starch mucilage alone. The amount of solution is 120 to 180 ml. Temperature of the solution is 100 degree to 105 degree Fahrenheit. Next is sedative enema. It uses a sedative drug to induce sleep. The drugs used are paraldehyde, chloral hydrate and potassium bromide. Next is anesthetic enema. It uses an anesthetic drug to produce anesthesia in the patient. The drugs used are Avertin 150 to 300 mg per kg body weight. Next is proctoclysis enema, sodium phosphate enema. It's a saline laxative. Within 15 to 30 minutes, the urge to defecate should not be given to children less than 2 years. General instructions while giving enema includes appropriate size catheter or rectal tube should be used. Rectal tube should be smooth and flexible. The rectal tube is lubricated. Temperature and amount of solution should be appropriate. The position is left lateral and check for any fluid overload. Some important points. The height of the enema can 45 cm, that is 18 inch from bed level. For retention enema 20 cm, that means 8 inch from the bed level. Depth of insertion in infant 1 inch 2.5 cm, in child 2 inch 5 cm, in adult 3 to 4 inch, that means 7.5 to 10 cm. So these are all about my topic. Thank you for watching.